My name is Dr. Paul Allegra. I'm an orthopedic surgeon with a sports medicine fellowship focus. Today I'm going to talk to you about orthobiologics and platelet-rich plasma, or PRP, injection therapy. PRP are probably the three most common letters other than ACL that I hear in my practice on a day-to-day basis. I get patients asking about it all the time. It stands for platelet-rich plasma. It's your own tissue, it's your own blood, and we centrifuge or spin down your blood in order to extract all of the healing factors, things like cytokines and interleukins, things that are going to assist with healing. What I liken PRP to is a bee sting. A bee sting involves all of those chemical signals rushing to the area to generate a healing response. That's kind of what PRP is like. Platelet-rich plasma, or PRP, it's a newer therapy, so there are newer indications coming out as the research evolves. Traditionally, it's been used for soft tissue, things like tendons, ligaments. We're seeing more and more that it actually has an advantage in the treatment of mild or early osteoarthritis. I always tell people that PRP is not a panacea. It's not going to cure or treat arthritis. It's not going to prevent cartilage wear, but it can help to treat the symptoms of osteoarthritis. Additionally, it is also very beneficial in the treatment of soft tissue pathology, specifically things like lateral epicondylitis or tennis elbow, hip abductor tendinitis. I'm a big believer in PRP and the addition of orthobiologics. Oftentimes, I will use it as an adjunct in surgery to assist with things like meniscal repair healing, ACL graft incorporation, or labral repair healing after hip arthroscopy. I think it's an exciting time to be a patient and also an orthopedic surgeon because of all these advances, not only with platelet-rich plasma therapy, but orthobiologics in general. Our patients heal better without surgery. These are things that are at our disposal and available not only in the office, but in the operating room. When I have a patient who's interested in PRP therapy, that patient can expect to come to the office. We'll undergo a thorough history and physical examination. Additionally, I'll obtain x-rays of that extremity in question. And if we think together that PRP injection therapy is a good option for you, we can talk about the next steps. PRP is not typically covered by insurance. It's typically a cash-based payment. What we'll do is schedule you for the PRP injection therapy in one of our radiology suites. We do it with either ultrasound or fluoroscopic guidance, depending on the joint. A trained phlebotomist will perform a blood draw for you. That blood will then be centrifuged for you. During that period, the blood is placed into a machine that will spin out the healing factors and concentrate them. That can usually involve a 15 to 20 minute wait, at which point you're either applying ice to the extremity in question to prepare it for the PRP injection therapy, and you can enjoy time on your phone, some light reading. After this time, we'll prepare you for the injection. We'll either use an ultrasound or fluoroscopic guidance, which is x-rays, in order to place the needle directly where we think the medication is needed. After this, a Band-Aid is applied and you can go about your day. I always like to tell people that after a PRP injection, it's kind of like a bee sting. So it can sometimes get worse before it gets better. When we're putting all of these pro-inflammatory molecules into a site and trying to generate a healing response, it can actually create some irritation. It's important, though, that patients do not take anti-inflammatories because those are going to counteract the effects of the platelet-rich plasma. We want inflammation. Inflammation helps to generate a healing response. So it's important that those medications aren't taken. Things like over-the-counter Tylenol, ice, those are useful as well. There are some other restrictions that we can go through when you're considering having a PRP injection. Patients often ask me, when can I start to feel the effects of a PRP injection? Really, it depends on the pathology being treated, but a PRP injection is unlike a steroid injection in that it's not instant relief. Patients come to the office who receive steroid injections, maybe lidocaine injections. They can expect pain relief within 3 to 4 days, sometimes instantaneously. Patients receiving PRP injections, I liken it to a slow burn. We're about the long game with the PRP injection. We need your body to do the work in combination with the inflammatory molecules we've injected into the site of injury. So I like to tell people it can take 3 to 4 weeks before you start to notice a difference, but we combine therapy with stretching and exercise in order to generate a healing response. Really what we're looking for is the long game, perhaps a month or two before we start to see tangible benefit. Sometimes patients will ask me, how many PRP injections can I have? Research shows actually that different pathology, things like tendonitis, soft tissue pathology, actually respond better to a series of PRP injections spaced out by a week, and that's about 2 to 3 injections. Things like arthritis of the knee typically would perform about 1 to 2 injections spaced out by a week. And there's no maximum amount of PRP injections you can have, but I will typically dissuade patients from having multiple PRP injections if they're not getting much benefit. There are minor risks associated with a PRP injection. There is a blood draw, so there are minor risks associated with the blood draw. You can expect some mild pain at the site of the injury. As with any therapy, there is a risk with PRP that you get incomplete symptom relief or fail to have symptom relief at all. I think PRP is a really exciting therapy. Again, it's an exciting time to be an orthopedic surgeon. It's also an exciting time to be a patient. The indications for PRP are ever expanding. Patients who have failed to have significant improvement in soft tissue pathology or perhaps mild arthritis are excellent candidates for a trial of PRP therapy. If you think you're someone that is interested in PRP, you want to talk to a professional about PRP, you should make an appointment with us at Seaview Orthopaedics to discuss it further and potentially have the injection performed.